we're talking about going to the doctor, a lot of it is centered around just kind of helping you be more prepared, helping you make sure you get all the answers to your questions when you go, some tips, some ways to try to save money, that'll save you money personally, that'll save PAC more money as well, and I don't know what else. We'll find out. So, 5 basic topics. How to find a doctor. I get that question all the time for people that don't go regularly, that don't have someone that they see on a regular basis. How do I find a doctor? Where do I go? Where do I start that process? Preparing for your doctor visit, things to know during your doctor visit, kind of a post-doctor visit recap, what maybe additional action the doctor wants you to take after your visit, and then some ways to save money during that whole process. So, the first question, how do I find a doctor? Okay, you need to answer 3 questions. Okay, do I need a primary care doctor or a specialty doctor? Okay, a primary care doctor or a general practice doctor if you're just going for a checkup, if you're just going for a minor, you know, I've got a sniffle, something like that, okay? For the most part, that's what you're gonna need, is a primary care doctor, okay? And then if you need a specialty doctor, the primary care or your general practice doctor will say you need to go to, you know, a specialist of some kind, and they will give you referrals, or they'll give you a list, a lot of times, of potential referrals, okay? For the most part, it's gonna be a primary care doctor that you're gonna be looking for, okay? Next thing you need to know is the doctor in my health insurance network, okay? As you should know, okay, you have in-network and out-of-network providers, okay, for your health insurance. The in-network providers are less expensive, okay, than the out-of-network providers, okay? So that's an important question to find out, okay? And is this doctor a quality provider? Okay, you can research that on the internet, and you can go to their website, and you can, you know, go to Google and do, you know, reviews and research, is this a quality provider, okay? Because we would all assume that every doctor is a quality provider. However, that's not the case, okay? Some are better than others, and there are ways to find out that information. So, do I need a primary care or specialty doctor? Okay, the difference, a primary care doctor is a doctor who diagnoses and treats a wide range of common illnesses and conditions. Okay, primary care doctors also provide patient education, offer advice on preventing disease, coordinate care if a specialist is needed. Primary care doctors may be certified, which means they have special skills in different areas such as family or internal medicine. So a lot of times your primary care doctor will have some kind of additional area of specialty, okay? A lot of those guys are general practice, family practice doctors. And again, common illnesses and conditions, real basic stuff. They'll work with you on preventative things, and they'll refer you to the next level to a specialist if that's necessary, okay? A specialty doctor or a specialist has advanced training in a certain area of medicine focusing on a particular disease, condition, or procedure. Common types of specialists: allergists, cardiologists, surgeons, oncologists, you know, the list goes on and on and on and on, okay? General specialists also can refer patients to go with more complex diseases to doctors with more expertise. So once you get to the level of specialist, then if you've ever had to kind of go down that route, you know, then you can go to the next level of an additional specialist, okay? Someone who has even more training on a particular, you know, kind of that disease, a particular condition, a particular type. So if it's an allergist, it might be a particular type of allergy. There's a specific allergist that deals with people that are allergic to peanuts, you know, or they're allergic to whatever, you know, dandelions. It doesn't matter. So there's times where you can go to a specialist and then they'll refer you to another specialist, okay? And so that's usually the track that you end up taking. Good morning. Okay, so the next question is the doctor in my network. Okay, there's a couple ways that you can figure that out. Okay, number one is you call the number that's on the back of your card. Okay, on the back of your Cigna insurance card, or if you don't have insurance with Packmore, on the back of whatever insurance card you have, there'll be a number that you can call to figure that out. Okay, if you have insurance with Packmore and Cigna, you go to mycigna.com. Okay, you click on Find Docs and Services, and then you can pick a bunch of different ways to focus your search. Okay, so you can base it on distance. It'll allow you to pick, you put in your zip code and you say, I want a list of every doctor within 5 miles, or 10 miles, or 20 miles, or 50 miles. Okay, be careful how wide you get, because you could have 1,000, results from your search. Okay, you can pick a specialty or general practice, primary care doctor. You can also pick from different quality distinctions and different pricing or cost efficiency ratings for the doctor. Okay, so those are all available on mycigna.com. Okay, and that's one of the ways it can help you save money, is by the cost efficiency ratings for all the doctors. Okay, and also you can compare out-of-pocket estimates, okay, on that search. So it'll give you an average of out-of-pocket estimate for seeing that particular doctor, which that's very helpful information, obviously. Does anybody have any questions about this? Because this is a big piece of, this is a question that I get all the time, is how do I find a doctor? Okay, the number on the back or the website. Okay, an additional way is if you have a doctor that you want to go to, let's say one of your family members or your friends, to say, hey, I go to this guy, I go to Dr. Shooter, he's awesome. Okay, you should really go to him. Well, how do you know if Dr. Shooter's in your network? So you call Dr. Shooter's office and say, hi, my name is Manuel. I would like to, see Dr. Shooter. I was referred to by my cousin Levi, and he said, you're great. I need to know if you're in my network. I have Cigna. This is my insurance information. And a lot of times is the receptionist there will call on your behalf to see if you're in network, and then they'll let you know. Okay? Put the onus on them, have them call. Okay? A lot of times they'll know right away. They're very familiar with who they are in network with, and they'll know, yes, we are, or no, we're not, or I can check. And they can find out that's part of their job responsibilities. Okay? So if you have someone that you want to go to and you're not sure and you're having problems finding it on the website potentially, just call their office and say, hey, I've got Cigna Insurance. Are you guys in my network? Does that make sense? Okay. All right. Again, is this doctor a quality provider? You can do a quick check for doctor quality. Are they rated to give quality care? Again, this is part of the search that you can do. Do they have training and background that meet your needs? You can go to their website and look at their bio, okay? Or you just can flat out Google the doctor, all right? And you'll be able to find information on them. And another big one is, do they have privileges at the hospital of your choice? So are they a doctor that goes to St. Margaret's here in Hammond, which is where you would potentially need to go to the next level, or are they going to tell you, all right, you got to go to Evanston Northwestern Hospital, that's the only place that I practice. So you got to drive an hour and a half to the north side of Chicago to go, if you have to go to the hospital, that's where he's going to send you. Okay? So again, those are big things. Do they have the background and training, different certifications, areas of specialty perhaps? And do they have privileges at the hospital of your choice? So hospitals that are close to where you live, of where you're going to want to go. Or if you have a particular hospital that you like to deal with in your family, is it that hospital? All right, so now we've found our doctor, so now we're going to prepare for our doctor visit. Okay, so you should have this information somewhere. okay? And I'm sure not many of us do. I know I don't. I get to the doctor and I fill out that form, you know, like I've never seen it before, and I don't have any idea what I'm doing every time I go in, okay? So a list of immunizations and dates, okay? Current medications that you're taking, including herbs, supplements, anything like that, okay? An updated family history, okay? If you have family members that have had certain conditions, or, you know, a lot of the questions you'll get asked are, do you have a family history of cancer or heart disease or diabetes, things like that, okay? Have that information written down. Maybe you don't know. Talk to a family member. Talk to mom. Mom knows all that stuff. That's part of being a mom. They know every condition that anyone in your family has ever had and the dates in which they had it, okay? Any allergies you may have, okay? Any operations you've had and the dates, okay? Any active medical illnesses, anything that's going on right now, okay? So this you should have when you go into the doctor's office. You should have a sheet that has this information on it ready to go. Because a lot of times they'll give you a form when you go in, okay, your appointment's at 3. They're like, okay, you got to be here by, you know, 2:30 or 2:45, because when you go to the doctor, I mean, they are right on time at 3 o'clock, and if you're not ready, they're going to be upset, okay? Okay, that was funny, Shooter, you should laugh, because you're never ready, okay? But they want you to be there a half an hour early, just in case that they are, okay? So they're going to give you that form to fill out, and it's going to ask all these questions, okay? A lot of offices are getting smart, and they're giving you a portal to do it online. It saves, you know, eliminates paper. You can do it everything online. So if you call and set up a doctor's appointment, a lot of times they'll ask for your email address, and they will email you, you know, some information about the practice a lot of times, and then a portal or a link to click on that you can create what's called your online clipboard. My wife just did this. She went to a doctor, and they sent her this email with a link, and she creates her online clipboard, and then the doctor can post things on there related to your visit, or if there are tests that you're waiting for results from, they'll just post them right to the clipboard so that you don't have to wait for the doctor to call you. She can just log on and check, oh, he posted these results on here for me. I can look and see what they are, and any notes that he may have regarding your visit. But anyways, this is information you need to know, okay? And this, if you are going to go to the doctor, which you should every year for your well-checked visit, they're going to ask you these questions, okay? And instead of having to try to remember them in the doctor's office, if you just have a list, okay, that you keep on a sheet of paper, you know, most of this isn't going to change, you know, on an annual basis. Change a little bit, but for the most part, a lot of this, the immunizations and your dates, that's going to be the same. Your family history is going to pretty much be the same. Your allergies, you're going to know. Operations and dates, a lot of this information, you know, isn't going to change on an annual basis. You'd have to make little changes to it, okay? And this is important information so you have accuracy when you go. Next, preparing for your doctor visit some more. Make a list of things you want to discuss, okay? So what are your questions? Bring any necessary medical information such as x-ray films, test results, medical records. Okay, come prepared. Consider bringing along a trusted relative or friend to help ask questions. Okay, a lot of times when you're there and you're in the moment and you're talking back and forth, you know, it's like when you're on the outside looking in, you have a better vantage point. You can ask different questions, okay? So bring somebody with that can help ask questions. Okay, so the last thing you want to do is walk out of the doctor's office and say, oh, I wish I would have asked this. I wonder about this. How many of us do that when we leave? We're walking to the car and we're like, man, I wish I would have known this, or I wish I would have asked this. We always do. So this will help you eliminate that if possible. Okay, so during your doctor visit, okay, be honest. Okay, the most important thing, be honest. All right? Don't feel intimidated. Prioritize your complaints, okay? The most pressing issues first, okay? Be willing to subject yourself to probing and prodding, okay? That's part of what they do, okay, to figure out what's going on, okay? Ask questions, take notes, write down stuff, okay? Ask the doctor to write down any instructions so that it's clear of what you need to do, Okay, ask the doctor for printed materials about your condition or suggestions for where to go to get more information. Okay, ask the doctor if it is okay to record the visit to help remember his comments and instructions. Okay, if you have a smartphone, you can set it down and record the whole thing. Okay, ask the receptionist for a detailed bill of services and a practice profile. Okay, so ask them for, what they call a super bill of exactly what it is you were charged for what. If it was just a simple consultation, it'll probably be just one thing. But if you go to the doctor and they do some things on, some additional things, have those listed. And the practice profile is just kind of a generic, this is what our practice is, this is what we do, this is who our doctors are, this is what we specialize in, this is what we're all about. And it'll have all the information, all the hours, the phone numbers, and those kind of things. Okay? So now that you've gone to the doctor, review your notes from your appointment. Did the doctor answer all your questions and provide you with quality information materials? Okay? Do you need to seek a second opinion? Okay? Do you need to see a specialist? Okay? Do you need to schedule another appointment, either with that doctor or with a specialist? Or do you need to schedule an MRI? Do you need to schedule an X-ray? Do you need to schedule a time to go to the lab to do some tests? Do you need to pick up any medications? Okay? Again, you need to schedule tests with additional providers. Okay, those kind of things. You need to get that figured out right away. Okay? Let's say you're going to the pharmacy. You've got medications to pick up. Okay? If the medications are prescribed, ask these questions. Okay? What is the name and what is the drug supposed to do? A lot of times when the pharmacist gives you this, they'll explain this to you. Okay? My experience with pharmacists has been very good. They'll explain, okay, this is what it is, this is what's going on, this is how many times you take it, but make sure these are the questions that are answered. Okay? When and how do I take it? How long should I take it? Can the drug cause an allergic reaction? Should I avoid alcohol or other drugs or supplements or other activities while taking this? Okay? What are the side effects? What happens if I miss a dose? Okay? Is it safe to become pregnant or be breastfeeding while taking this medication? Okay? Is there a safe generic version that I could use that'll save you a lot of money? Okay? Is there special storage requirements for my medicine? Does it need to be refrigerated? Does it need to be room temperature? Does it need to be kept under your pillow? Whatever. Okay? Okay? So, additional ways to save money. Okay, we talked about make sure your doctor is in network. Okay, that's the biggest one. And make sure your doctor is in network. Okay, use primary care or immediate care doctors instead of emergency room visits whenever possible. Okay, if it's during normal business hours and you can go to an immediate care or a primary care center instead of going to an emergency room, that's going to save a lot of money. Okay, for you, your deductible for or your copay for an emergency room visit is much higher than your copay for a regular doctor visit. Okay, and 77% of all emergency room visits don't need to go to the emergency room. Okay, they are non-emergency visits. You can go to a primary care. I'm not saying if you have an emergency you shouldn't go to the emergency room. I'm saying if it's a non-emergency visit, if you have a sore throat, it's probably not an emergency. Okay, you can probably go to a primary care and you'll get through a lot quicker and you'll save a lot of money. Inquire about the costs of all services. Okay, it is completely okay to ask the doctor, how much is this going to cost? Okay, it is completely okay. All right, ask how much is the MRI when you have to call to schedule the MRI. How much is this? Okay, X-rays, special tests, whatever. It is okay to ask the doctor, how much does this cost? How many people have ever asked the doctor, how much does this cost? Okay, one person out of a room of, we have at least a dozen people in here. Okay, very, very few of us ever ask. Okay, we just go. It's one of those things you just blindly go and you pay for. Okay, ask how much it costs. It's okay. All right, it's absolutely okay to ask how much it costs. Inquire about generic drugs instead of name brands whenever possible. Okay, when your doctor's writing out your script, okay, ask them, is there a generic, option that I can utilize? Or a lot of times they might not know if there's a generic option, but they can note it on the prescription that'll say, I want you to take Nexium or the generic option. Okay, they can put that on the script so the pharmacist can give you the option of the two. Okay, because sometimes the pharmacist won't take the initiative to call the doctor back and ask, hey, can I give them the generic? Because if it says you have to take this, really the pharmacist has to give you that. They have to give you what the doctor says. That's the only thing they can give you. In order to give you a generic option, they're going to have to take the initiative, either initiated by you or themselves, to call the doctor back and say, hey, can I give them this instead? It's the generic option, which is obviously going to save you a lot of money. And it's exactly the same thing. Okay, any questions on any of that? Okay, so just to summarize quickly, okay, we all need to assume medical responsibility. A lot of that is, where we're going to the doctor, picking the right doctor, being prepared when we go, being prepared once we're there, reviewing what we've done once we're there. Okay, keep records, research the best doctor option for you, whether that's location, in-network, the cost of the services. Use an immediate care or primary care whenever possible. Okay, show up prepared. Okay, take notes. Okay, know your numbers, know your data. Okay, know if you have traditionally high blood pressure. Okay, know if you have traditionally high blood sugar, so that when you have results come back, the doctor isn't like, oh my goodness, and you're like, yeah, that's pretty much where I usually am. Okay, ask questions. Okay, acknowledge your symptoms to your doctor. Be honest. Leave with informational materials whenever possible. Stuff that you can read after you've left. Okay, again, use generic drugs instead of name brands whenever possible. Does anybody have any questions?